There's so many things that happen in the body, your hormones. Women, you get pregnant, your hormones are like that, do this, do that. And for some people, that can lead to gestational diabetes. When the pancreas is gone, there is no insulin being made, which means that when they eat food, the insulin is not able to break down this food, and as a result, there is high blood glucose in there. Now, being on steroids, it has a way of pushing the blood sugar levels up and can lead to what we call steroid-induced diabetes. Listen. Not everybody who has diabetes is walking around with symptoms. There are so many types of diabetes that are out there. Some people say, do you have the worst one or do you have the better diabetes? Is there any diabetes that is better than the other? They all carry equal risk. They all carry the same type of complications. One can be more life-threatening, but does not mean that it's a worse off. So you don't walk around asking people, do you have the worst type of diabetes? Are you the type of diabetes that you die? No. We don't ask those questions. Now, for simplicity's sake, there is type 1 diabetes, and the individuals who live with type 1 diabetes are what we call insulin dependent. So their body depends on insulin. Their pancreas, which we've covered in another video. If you haven't watched it, please watch this video. The pancreas is completely gone, and now the pancreas is the hormone that is responsible for making insulin. When the pancreas is gone, there is no insulin being made, which means that when they eat food, the insulin is not able to break down this food, and as a result, there is high blood glucose in there, and that can lead to complications which we don't want to happen. So individuals who live with type 1 diabetes often end up on lifelong insulin. Obviously, technology is happening daily, so we are hoping that technology one day will be able to resolve this. But for now, as of 2025, when I'm doing this video, people who live with type 1 diabetes are completely insulin dependent. They use different insulins to regulate their blood sugar, which we'll cover in another video. Now we go on to type 2 diabetes. Type 2 diabetes, people say, you have type 2 diabetes. You must have been fat because you're big. You have diabetes. Slim people do not have diabetes. No. Type 2 diabetes, yes, it's quite common in people who are overweight or obese. We tend to have more of the fight against diabetes. However, there are people who have the smaller nature who have type 2 diabetes. Believe it. Trust me. There are people who walk around, can be a very small size, but they're walking around with diabetes. Sometimes people say it is the lifestyle condition. Yes, your genetic factors play an important role with this. And as a result, we always advise that you know your family history of diabetes. That plays an important role as you get on in life. You get to understand, did my mom have diabetes? Did my granddad have diabetes? Does my uncle have diabetes? So what do I do? If my family has diabetes, it means that your risk is higher. So you have to be a little bit more conscious and have more checks done. Everybody should have checks. Now we're going to move on to gestational diabetes. Now, this is diabetes, not somebody who has type 1 diabetes already or type 2 diabetes already and then gets pregnant. Those people are people who are pregnant, but then they have diabetes. However, gestational diabetes is diabetes that are caused as a result of pregnancy. There's so many things that happen in the body, your hormones. Women, you get pregnant, your hormones are like that, do this, do that. And for some people, that can lead to gestational diabetes. Oftentimes, this is actually picked up by like week 28. You go for what we call a glucose tolerance test. Depends on what part of the world that you're in. But most places will do a glucose tolerance test for you. They get you to drink some fluid that contains some high level of glucose, and then they test you a couple of hours later. And if your levels are actually raised, you are noted to have gestational diabetes, and how that is managed, it depends on the diabetes team. There is also something called latent autoimmune disease of adulthood. Every time I say that, people are like, what? In simple terms, it is called LADA, LADA. Some people say it is a type 1.5 diabetes, so they can display features of a type 1 diabetes and features of type 2 diabetes, right? They are somewhere in the middle. Sometimes you can pick up straight away when someone presents with symptoms that they are a LADA. Oftentimes, as well, you can also get people go on and be diagnosed with type 2 diabetes, but further down the line, we're thinking, things are not adding up. We have certain features in them that make us as clinicians say, I think we need to do what we call an autoimmune test on you. And oftentimes, the results that we get will come back showing there's some antibodies that are positive, and that then just gives us the fact that you are a type 1.5 or a LADA type of diabetes. For some, like I said, it is straight away that we pick it up, and for others, it takes a couple of years before this is picked up. Now we have steroid-induced diabetes. For some reason or the other, some people are on steroids, either they're on cancer treatment, some form of treatment that they need to go through, and they're long-term basis of steroids. I'm not talking about steroid that you take 1 or 2 days because you've been given by your doctor. I'm talking about long-term steroids. So you're on it for a couple of months. Now, being on steroids, it has a way of pushing the blood sugar levels up and can lead to what we call steroid-induced diabetes. Again, that's another topic that we will cover at another time. Now, I'm going to go on what we call type 3C diabetes. People are like, type what? Type 3C diabetes. So this is many people who have issues around their pancreas. Either there's like pancreatic cancer or there is something called chronic pancreatitis. Things around the pancreas. Remember, I talked about the pancreas being the organ that is responsible for producing insulin. When there is a problem with the pancreas, obviously there will be a problem producing insulin. And as a result, the blood sugar levels in the body will go high. So this is type 3C diabetes. There are so many other types of diabetes that I'm not going to go into. It is not your duty to say, when you're walking down the street, either are you type 1, type 2, type 3C, are you? We're not there. How we manage the different types of diabetes is down to the clinician, okay? People who live with diabetes would know, and they'll be in constant communication with their clinicians who'll be working with them. Some are better managed under secondary care, which is like hospital-based with consultants, and others can be managed in primary care. So your family doctor clinic, private, clinics, and you have nurses, pharmacists like myself who are specialized in managing diabetes, and we can manage from diagnosis all the way through to insulin. But I would advise that whatever type of diabetes you have, you take the journey with your healthcare professionals. They're not after you or signed up with companies to make sure that you're on drugs that you do not need. No, we're making sure that your blood sugar levels are stable, are fine, so that hopefully the complications of diabetes are actually reduced. Do you get me? Now, people will say, oh, you've talked about diabetes. How about the symptoms of diabetes? I want to know the symptoms of diabetes so that I can know if I have diabetes. Listen. Not everybody who has diabetes is walking around with symptoms. You get me? You're like, what? What? Yes. Not everybody who has diabetes has symptoms of diabetes. However, there are symptoms of diabetes. People can get extreme thirst. So you're drinking, but you're not satisfied. You get this constant thirst, okay? Some people wake up in the night gulping for water. Through the day, you're constantly dry. Your mouth is dry. I would say look into that. You're constantly urinating. You pee, you go back, you pee, you go back. It's like you might as well just camp outside the toilet, right? Just put your chair outside the toilet, because that's the best thing, because you don't even make it to the living room and you want to go back to the toilet. You are peeing that much. For children, sometimes they're bedwet. Now, if your child is like 8, 9 and they're bedwetting, I'm not saying that bedwetting is the reason for diabetes in every child, because there are different things that lead to that. However, if your child all of a sudden is starting to bedwet and is constantly tired, then you need to look into it as a parent. Now, talking about tiredness, lethargy, which is extreme tiredness, is another symptom of diabetes. People are like, I can't stay awake. I'm watching the TV and I can't stay awake. I'm barely awake during the work time. You're tired. There are other things that can lead to tiredness. But if you're constantly tired, I think it's about time that you take yourself to the doctors and go and have that blood test done. For some other people, they get recurring balls on their body. So the balls come, the balls go, the balls come, the balls go. All these symptoms that we're talking about and many other symptoms of diabetes are things that you need to look into. Don't say, oh, it's not my portion. Oh, I jump and pass. Oh, no, this is not for me. Listen, we understand that it is not for you, and we do not want it to be for you, because in as much as we are diabetes specialists, we also want you to be well. So the best thing that you do is pick up the phone, call your doctors, book an appointment for a blood test, tell them what's going on, let them do the blood test for you. It is better that they come back and say, hi, hello there, we've actually done the bloods for you and your bloods have come back fine, and you be like, phew. Or you get a phone call to say your blood sugars are a little bit on the high side, would like you to come in to speak to one of us, or we talk to you on the phone. And when we're doing the talking on the phone, we are actually saying, let's put you on this medication or this lifestyle changes and bring your blood sugar levels down. So whatever the situation is, first, make an appointment. 2, when that phone call comes, if it's good, hooray. If it's not so good according to you, listen to what we have to say and let's help you. I hope this makes sense. We will break down the different symptoms and why you get those symptoms as we progress through the videos. So many people are walking the earth and yet they do not know that they walk around with diabetes. If you've had a history of gestational diabetes, check yourself. If you have a family history of diabetes, check yourself. If you're overweight, like some of us are struggling, check yourself. make sure you go at least every 6 months to 1 year to check yourself, because it is very, very important. Hi, I'm Tonye Oburoh. I'm the founder of Diabetes Consults, which is a private pharmacy and a private clinic that looks after people with type 2 diabetes. On this channel, we simplify things for you. You can see how relaxed I am. We do not throw stones at you because you have diabetes, but no, we help your understanding of diabetes so that you can make more informed life choices, more informed decisions about medications, and we walk with you on this journey. We're here to hold your hand because our logo says that your health is our passion. We're passionate about your health and we want you to live well. We want you to live strong. We want you to live free of complications of diabetes where possible. We want you to click the notification button, subscribe to this channel if you've not subscribed, because you get to see pretty faces like this. But then again, we're simplifying things for you. We have materials that are free of charge for you that you can download that would help your understanding. If there are things that you want us to create for you, things that you want to see, please put it in the comment section and we'll do our best to answer your questions as simple as possible. You can live well with diabetes. You can live strong with diabetes. You can live long with diabetes. The most important thing is making sure that you're on the right treatment path. I hope you found this video helpful. If you have, like it. Again, subscribe. See you again another time. Take care.